It's me, Olga. I'm doing the labor and delivery skills module. Sorry, it's taking me forever. I apologize. It's been 3 weeks from hell, but we're past it. I hope I got everything together and trying to make this as real as I can with what I have. Anyways, so I have two preceptors that I work with. One that calls me as soon as the mom calls her, and she's likes to labor sit. So she comes there, and there has been times that we've been there for days. And then I have the second preceptor that is only she'll come and check, and then she comes back when they are in active stage, and that's when she'll call me. So I'll come to births with her. I have rarely sat with her for a long time. So with this module, I'm going to pretend that the mom has called and we've come and checked on her, and she was doing pretty good. We left and she called back, and she is now in active labor. So what I would do if I was the midwife, what I would do is I would come in again when she called, and I would first assess her. I would do her vitals, blood pressure, pulse, temp, and then I would listen to the baby. I have to use this as a Doppler because my Doppler is gone. I would listen to the baby to establish the fetal heart tones and the baseline of where she's at. And then I would offer to do a vaginal exam just to see where she is at. I would say that with this preceptor that comes only during the active stage, about 80% say that they do want vaginal exams. And so she would check them. She would let them know what they are, and then she would go on from there if she needs to call her assistant, if she needs to call anybody else, and get everything set up. So I'm putting on my gloves. I would check her, make sure she's comfortable, and let's say that she is at an 8. Then I would get all my tools set up. We usually have a birth tray that we carry around with us. We have delivery tools on there. We have the resuscitation mask and board. We have gloves. We have the suction bulb, the gel, sterile gloves. What else? And then on a different tray, we have like the vitals. And having an assistant, we have an assistant that charts all the time. And then me as a student or the midwife would do fetal heart tones. And if she, let's say she is pushing right now, she starts pushing. Well, before she's pushing, we check vitals, not vitals, but fetal heart tones about every 15 minutes when she's in active stage, 15 to 20 minutes. When she's pushing, it's every other push that we check vitals. Not vitals, but fetal heart tones. Sorry, guys, super nervous. Don't like being on camera. Anyways, so we would listen after every time she pushes. My preceptor, I guess I could have put gloves on, but my preceptor likes to support the perineum. So what she does is she'll keep a warm washcloth as they're pushing, and she doesn't like, push, push, push. She does not like to do that. She lets the body push. So it would just be like, if you feel a contraction coming and you feel the urge to push, then you can push. I have my hand here. Let me know if that's bothering you, because there has been times when the mother, don't touch me. So we always make sure that's not bothering them. We talk them through the ring of fire. We don't let them, pull back away from it or get scared. And if the head rocks back and forth, she talks them through, keep the head there. So the next contraction, you can push a little further and a little further. And, it also depends on how the mom wants to be at. She can either be on hands and knees, she can lay, we try not to keep them standing depending on if she's in the water. That's another thing, is if the baby comes out to the head and we can tell it's a shoulder dystocia, that's when we get the moms to flip. We'll get them on hands and knees, or we'll put their legs up further, or, get her up on like the Captain Morgan kind of position. Otherwise, we let her follow her body. If she wants to lay, she can lay. If she wants to be on her knees, she can be on her knees. Whatever is most comfortable for her to push, then we do that. My preceptor, I call them the younger one and the older one. The younger one that comes when they're inactive, I've only been working with her for about 5 months, so we do 4-handed catches where I catch with her. My older preceptor, I've been catching on my own. So, anyways, so the baby's coming out. You guys like my little pelvis and my little baby. So the baby is coming out, it gets to here. This is when the next person, we have a stethoscope and we're looking for a cord. We're making sure that the baby is not there for a long time. So 2 minutes is hers, like shoulder dystocia. If it's a shoulder dystocia, she doesn't go further than 2 minutes. So somebody is telling time every 30 seconds. It's been 30 seconds. It's been a minute. It's been 30 minutes. I mean, 30, a minute and 30 seconds. And then baby comes out. I also do the job of watching, how baby rotated and how baby came out. And then right away, as soon as the baby comes out, we put baby on mom and we listen to baby and make sure the heart sounds good and the heart rate is good. We wipe secretions and do APGAR scores really fast. So we're checking for tone, we're checking for color, we're checking if baby is crying, and if baby is moving. And so we have somebody on baby and we have somebody on mom. And so the person that's watching mom is looking for bleeding. If the bleeding is severe, we have pit ready that we're automatically goes in her thigh. And then while baby is up here and she has the assistant come and deal with baby, make sure baby is warm and checking temperature and stuff, we are dealing with the placenta. So which I don't have a fake placenta, but there has been births where I have seen the placenta come out after 2 hours, and then there have births that she calls them active management, where she gets the placenta out. The fastest I've seen a placenta come out is 9 minutes. So that's been my. I know there have been faster times, but she doesn't really tug on the cord, but she kind of just does a little traction to see if it's moving at all. And that's another good thing about working with two preceptors is one doesn't touch the placenta at all. She lets it do its thing while the other one does not let it do its thing. She uses hands and stuff to not let it be there for too long. So what happens is she'll slowly pretty much guide it out and she'll twist it and just twist it out, making sure all the membranes come out and aren't stuck. And she's super gentle about this process, like very slow, nothing rushed. And then once the whole placenta comes out, she makes sure it's all there and she puts it in the bowl. If we see that the mom and the baby are stable, the mom's vitals are good, the baby is good, they're both kind of just like in this bliss. We give them blankets, we bring her something to drink or eat, and we let them be for about 30 minutes. With my other preceptor, it's a little longer. And in that time, we take the time to catch up on the charting and get stuff ready for the newborn exam. So I'm hoping that I did all of this correctly. I'm sorry if I didn't, but that's how we do labor and delivery.